Hi, everyone, and thank you so much for joining the Georgia Recovers March webinar titled Rethinking Prevention, Empowering Students and Parents to Build Strong Communities. Okay, and for our agenda, we'll cover some housekeeping rules. We'll overview the Georgia Recovers campaign. I'll introduce our speaker for today, who will then present, and then we'll wrap up with our Q&A portion. So regarding housekeeping, this webinar will be recorded and a copy of the presentation will be available on the Georgia Recovers website. All attendees will be muted throughout the duration of the webinar. And please use the Q&A panel on the bottom of your screen to ask any questions. The chat is also available for any general commentary, but it won't be moderated as closely. The interpreter for today will remain spotlighted throughout the webinar. So to adjust your view and to see all of the panels and the speakers and panelists, click view in the top right corner of your screen and then select speaker or gallery. Users can also select the side-by-side view as well. Feel free to also use the stream text link to access the live transcription of the webinar, which Ashley will drop in the chat. And on to our Georgia Recovers overview. So Georgia Recovers is an evidence-based public health campaign aimed to reduce the prejudice and discrimination that is associated with substance use disorder in Georgia. The campaign is brought to you by the Department of Behavioral Health and Developmental Disabilities, and also builds off of the pivotal work of the Georgia Council for Recovery. So we have a few goals and objectives, including increasing knowledge about SUD and that recovery is not only possible, but probable. We want to improve attitudes towards those living with and or in recovery from SUD, and also strengthen the capacity of stakeholders, organizations, and individuals that are already responding to this crisis. So we have 3 pillars of work. Starting off with community connection. So Georgia Recovers connects with the community organizations across the state. We also have our Community Impact Committee, or our CIC, that guide the direction of the campaign. Story sharing is also really pivotal to the work that we're doing. We collect stories of recovery and allyship, and these stories are shared across our social media channels as well as our website. And for our educational pillar, we host these monthly educational webinars to shed light on topics that are related to substance use disorder. And we also promote messaging that speak to hope and recovery. If you are interested in connecting with Georgia Recovers online, head over to Instagram and Facebook and give us a follow at GA Recovers. Specifically for Instagram, we are really excited about reaching 450 followers. So head over there, see some amazing content from our story sharers, influencers, and also some of our community partners that are in this call today. If you are interested in becoming an official campaign partner, feel free to complete our community partner form, which Ashley will also share that link in the chat as well. And on to our speaker for today. Ryan Stringfield is the founder and executive director of Pathways2Life. His story of addiction and recovery, as well as his passion and experience working with youth, fuels him as he seeks to see resilient people leading others to growth. Pathways2Life is rethinking prevention by creating safe spaces for people and communities to engage their pain and find their way forward. Their innovative approach to prevention and intervention strategies like student assistance programs, parent and family support, and community collaboration are strength-based, person-centered, solutions-oriented, and are designed to increase understanding, connection, competency, and resilience. The organization has been working in the North Fulton, Atlanta community for over 15 years. Ryan is happily married to his beautiful wife, Pamela, and they have 2 sons, Josiah and Asa. And I will go ahead and pass it over to you, Ryan.
Thank you so much. It's an honor and a privilege to be here today with y'all, to be able to share a little bit of my story, but also a little bit of the work that we're doing at Pathways2Life. Hopefully it'll inspire you and encourage you and your work as well. So let me get this, see if I can get this set up here. And then do I need to swap the display here?
It looks like you're good to go, Ryan.
Oh, I was good to go, and now I messed it
Oh,
up.
yeah, no problem. We can go ahead and swap
Okay.
now.
Okay, let me see if I can get my little thing back over here. Okay, goodness gracious. Well, we went over this, and this is my fault here. So, all right, I think we got it now. Awesome. Yeah. So, like you heard from my bio, so I am a person in long-term recovery, and I'm coming up on 20 years this May. So, my recovery work and my personal journey of recovery is, the catalyst for the work that we do with Pathways to Life. So coming up on a little bit of over 20 years this May since I've been in active use of alcohol or any mood or other altering substance. And so I'm really passionate about this work because it was birthed out of my own journey and struggle. And so at Pathways to Life, we are about supporting and challenging our communities to rethink prevention from the family room into the classroom and beyond. And so believe it or not, the number one most effective strategy still is dinner as a family, and not just having a meal together, but it's the way that you communicate and connect through what we call courageous conversations to help our young people and our youth find their way, find their footing, and their path towards purpose and potential. And so, I always tell people that I stumbled into this line of work, but really recovery is not just about the absence of drugs and alcohol, but it's really about the presence of everything else that really matters, and the support and the skills to navigate life and the challenges and the blessings that life brings your way. And so one of the greatest blessings of my recovery is the ability to be in a healthy relationship. And so I've been married for like 15 years now, this beautiful woman, Pamela. And also I get the privilege of raising these two boys, Josiah and Asa. And so, they're such a significant part of my life and my recovery. And I'm extremely grateful for the life that I get to lead. And so our organization, as you heard, is about seeing resilient people leading others to growth. And so what we know is that resilience is the ability to bounce back from challenge or from difficulties. And in a lot of ways, we want to help people embrace and take responsibility for their own resilience journey, because we all have challenges and difficulties that we have to face. And how do we face those challenges head on? How do we embrace growth? And how do we find the support to find our footing and find our way? And so our work is primarily through what we call our three buckets, right? Our prevention and early intervention strategies, as was said, they're person-centered, strengths-based, and solution-oriented. We target three kind of buckets to strategize and inform our work. One is student assistance programs, and these strategies are delivered through campuses and on campuses, public and private school campuses. Number two is our parent and family outpatient support, and that is delivered in our office, but also across the community and campuses, providing what we call brief interventions, and that's really helping families explore, hey, what's going on with my youth, what's underneath the surface, and how do we partner with them in this growth opportunity. And then lastly is community collaboration. And that's really about how do we organize stakeholders around geographical areas to make sure that we are collaborating and working together to address the problems that we see with collective impact work. Yeah, so when we think about our work at Pathways to Life, obviously young people is our target audience, but in order to engage that target audience, we really need to partner with parents and also the stakeholders that represent, the gatekeepers to the audiences and environments where students are growing and developing, on their journeys. When we think about our work, so if we're just going in and engaging students, we miss out on the other relational environments, right, that are shaping, informing how they grow and how they develop. We often say at Pathways to Life, it's not just what we do, but it's how we do it and the way we show up. And so we lead vulnerably. We believe that there's no greater display of courage than one vulnerability. We also champion wholeheartedly. We believe that people have gifts and strengths, and we want to honor those gifts and strengths, and we want to draw them out, right? The purposes in their hearts are buried inside of them, and they need to be drawn out through safe and healthy relationships. And in order to do that, we have to listen intently. And so we're always about saying less and listening more, right? And listening is such an important part of our work, so that we can collaborate selflessly, because it's really not about us, but it's about or one individual organization. It's really about the we, and how do we come together to work together to create the community we want to see. And in order to do that, we need to engage competently, right? We need to understand cultural competencies. We need to, we need to have skills and trainings and methodologies to really know how to care for one another in a way that promotes growth. And so this is kind of our secret sauce, if you will. We also know that growth and resilience is best nurtured in a safe environment. And so, how do we bring ourselves to be a relational environment, but also to shape those environments that promotes growth and health? All right. So why does prevention and early intervention matter? Right. And I want you to think for a second about your prevention experience. And so for me, like my prevention experience was, I was thinking back, and as I think back, it was the DARE program. And with the DARE program, I remember, McGruff the crime dog, and, how they were talking about the dangers and the illegal nature of substances, but also in, underage drinking and the consequences, but also, the consequences, that can lead to death and car accident and things like that. And so, I mean, I didn't really resonate with the message, but at the same time, we all had our prevention message, right? And so I'm sure many of you remember this.
Okay, last time. This is drugs. This is your brain on drugs. Any questions?
Yeah, so I grew up in the 80s, right? And so this was one of the big campaigns that was like on the commercial, airwaves on every channel all the time. And a lot of the strategies in my experience were a lot about scare tactics, or um, or I would say, yeah, scare tactics, really trying to scare us from trying drugs, right? And so the history of prevention kind of started in the 50s, and it's evolved over the years. And what we know at Pathways to Life is our methodology and approach to prevention is really about helping people increase in self-awareness and understanding what's happening in their central nervous system at the time of their growth and development, what's happening in their brain, what's happening in their journey of self-discovery, and understanding their core values and their beliefs, their passions, understanding emotions, and how helping people with emotional literacy, knowing what they're feeling, how to communicate those emotions, how to understand them, and also decision making, right? So we want to help them with those self-management and self-awareness skills. And at the same time, helping people understand what's happening around them, right? What's happening in their family system and in their family environment, what's happening in their peer groups and their relational environments, what's happening in their school culture, what's happening in their team, right? All of the different environments where they live. And then also what's happening in the broader world, right? What's happening, globally, and even, on regional levels like states and countries. And so all of those things are a part of the prevention work that we do, right? It's not as simple as just telling people, hey, don't make bad decisions, right? And what we found is a lot of times the scare tactics and the more logical approaches to prevention, where they just provide information and tell people make good decisions, only reaches a small part of that audience, right? And generally that's the people who are not going to make those decisions anyway. So how can we evolve in our prevention methodology? So why does it matter? Well, the reason why it matters is because what we all know is teens are struggling like never before. Before COVID, there was a lot of data out that supported that 1 out of 5 teenagers struggle with a mental health challenge, right? But since post-COVID, now we know that some of the latest trends and data are saying that 1 out of 3 teenagers are struggling with some form of a mental health challenge. In our work, what we like to do is try to frame even the substance use and addiction conversation around mental health. And really, mental health just being as simple as helping people understand how they're doing in their overall journey of wellness, right? How they're doing psychologically, and how they're thinking, how they're doing emotionally, but also how they're doing socially and relationally. And so teens are struggling like never before. So it's so important that we are partnering across our communities to meet those struggles with understanding and empathy so that we can provide the support and the safe environments they need. But we also know that it's not only teens that are struggling, it's adults too. Remember, teens are not living on an island by themselves. They're living in families and communities where adults are struggling. And nearly 46,000 Americans die by suicide. Annually, approximately 1.2 million estimated suicide attempts, right? 74 million Americans age 18 or older reporting having substance use disorder and mental health disorder in 2020. And about 1 in 3 college students report dealing with a mental illness. And so we know that not only kids are struggling, but people around them are struggling. And those struggles that are happening in those family systems and in those communities and peer groups are directly and indirectly impacting the youth, right, that we are trying to reach. And so we also know that mental health challenges often start to surface or even take their shape in early life and adolescence, right? So we know that substance use disorder is really a pediatric onset, meaning that 9 out of 10 adults or 90% of people that progress to the point of having a substance use disorder initiated their first use or their use before the age of 18. What we're not saying is that 90% of people are going to end up with the outcome of addiction if they're using under 18. What we're saying is that people that do progress to the point of substance use disorder often started using under the age of 18. We also know that 50% of all lifetime mental illnesses began by age 14 and 75% by the age of 24. And so what that means is basically like the signs and the signals, the symptoms that are happening in someone's body and their mind and in their emotions and in their behaviors are starting to surface early. And then ultimately, we also know that suicide is the second leading cause of death among ages 10 to 14. And so this is why prevention and early intervention matters. It really matters. We have to get upstream to try to help support our youth, right? And we also know that trauma, the prevalence of ACEs are often what's underlying a substance use or mental health issue is really our experience with trauma. So how do we get ahead? How do we get upstream? How do we bring what we know now to begin to shape the way that we engage one another across the broader scope of our community? I want to show you a quick video, I think, that kind of just can highlight some of these issues and give us some momentum as we think about how we can work together across our communities.
Our brains control how we act in the world. But did you know the world around us also affects our brains? Our genes, environment, and social interactions all work together to shape the way our brains develop. Sometimes these factors combine in ways that create unhealthy thoughts or feelings. Over time, these unhealthy thoughts and feelings become so unmanageable that we need outside support to get better. 50% of people will develop at least one mental health condition during their lifetime, and half of those people will develop a mental health condition by age 14. Unfortunately, it takes about 10 years for people to get the treatment they need. We don't wait to treat health problems like heart disease or cancer until stage 4. We shouldn't wait to take care of our mental health. The right early treatment can change lives, reducing school dropout rates, hospitalization, incarceration, and unemployment. Imagine what the world would look like if we all got the help we needed when we first started showing the early warning signs. Start the conversation before stage 4. Visit mentalhealthamerica.net to get informed, take an online screening, and better understand your own mental health.
Yeah, so before stage 4, you know, I'm a person in long-term recovery, and I believe that recovery is probable and possible for all people, right? But for me, like, I didn't end up in my recovery journey until post incarceration. And I was 27 years old when I kind of started to embrace this idea of like, hey, I've got to find my way forward, and I've got to figure out how to live my life without the use of substances, right? And because substances, even though I started using and abusing when I was young in my teenage years through experimentation with nicotine and alcohol and cannabis, I started to develop, the substance use issue when I was about 13 or 14 was like kind of the epicenter, the beginning, right? And so what if my community, my parents, what if my peers, what if I begin to understand some of the things we know now, where I could have gotten the support I needed to help better understand what was happening in my way of thinking, what was happening in my emotions and around me, what was happening around me socially that was causing me to pursue, this substance use. And so it's important that that we, that we think about how the signs and symptoms are showing up and figuring out how do we begin to move our strategies upstream to identify people and help people identify before they progress to the later stages of mental health and addiction or substance use disorders. So what we know is that, there's a lot of barriers to getting this message to kids. And one of the greatest barriers that we have, and not just for students, but also for adults, is our journey with stigma and shame. So Jerome Adams, our Surgeon General, he says, folks often ask me, what's the biggest killer out there? Is it obesity? Is it smoking? I think the biggest killer out there is stigma. It keeps people in the shadows. Stigma keeps people from coming forward and asking for help. It keeps families from admitting that there's a problem. And so I know that in our work, there's a lot of misunderstandings, right? There's a lot of misinformation that I think is behind a lot of the stigma and a lot of the shame that people are experiencing. And I know for me that, in my recovery journey, when I found a safe place to begin to really unpack my pain and explore, some of my childhood experiences, what I found is that the things that I was experiencing internally, emotionally, even in my way of thinking and in my behaviors, were common, right? But I was feeling like I was the only one, right? And I felt so much shame about a lot of the things and the choices I was making and the things I was feeling, but I never put words to those feelings. I never put words to those emotions and those thoughts. And so in a lot of ways, I didn't until I found my recovery people, my recovery community. I was stuck in my own journey of personal stigma and shame, and it was keeping me stuck. And so it's so important that we work together to provide information, to educate and to help partner with people in understanding the skills necessary for resilience. But also in doing that, we can also provide the connection and linkage to care that people often need. The opposite of addiction is connection, right? It's not abstinence, right? It's not just abstinence, right? It's connection to yourself, it's connection to others, and it's connected to who you are in your core values and your dreams, your beliefs, and then living those out in real time. So we all know and remember our journey of adolescence, right? The journey of adolescence, we're trying to support youth, right? We want to engage them. We all know the journey, from becoming a child to becoming an adult. There's so much that's happening, right? So much that's happening in their growth and their development in their bodies, right? They're changing from being a child and, through puberty, they become an adult, right? And with those changes, so many things happen, right? Their brain begins to change, their emotions, their moods, even their understanding, and their insight into what they're experiencing and why. There's so much that's unlocking in this age. And so when kids are in this, what we call the transition zone, it's so important that they have adults with them, right? Even developmentally, what we know now is that kids, even when they turn 13 or 14, in their thinking, they start to, what it appears to rebel against the adults around them, right? Their parents or, their guardians. And it seems like rebellion, but really what it is developmentally, they're beginning to change their way of thinking to see themselves with autonomy, and so and at the same time they also need adults partnering with them to speak into and supporting their growth journey. And so we also know that now today the teens are struggling more than ever to trust adults and institutions, and so it's hard for them to trust, but they need people in it with them. So how are we helping partner with them in this incredible time of growth and development? We also know that this is an intense time of risk taking, and which is so important to their journey, but it can also be very dangerous, right? Especially in understanding the modern world and all the things that they're having to navigate. in addition to an already awesome and exciting but challenging zone of growth. And there's nothing that complicates their journey more than their journey with technology, right? And so, when I started working with youth, even 15, 16 years ago, like, technology wasn't as much of an issue, you know, but now, kids have access points, to the world at all times, right? They have the smartphone and the evolution of media and technology that's opened up our kids to a whole nother world. When we think about prevention from even a public health standpoint, we think about, you have your agent, you have your host, and you have the environment. And but you also have to think about the vectors. And these are the points at which, our kids are exposed, or our people, our audiences are exposed, right, to many things, right? And so we know technology is an incredible tool, but it can also give access and exposure to the world, to our kids, when they really, and we can't control those environments, right? We can't even influence those environments. A lot of times they're getting so much information. And one of the things that is complicating an already complicated time of this zone and connected to technology is their journey with substances. And so I'm going to talk a little bit now about some of the trends that we're seeing, as it relates to partnering with youth and understanding their journey in the modern substance landscape that's connected to that. So alcohol is still the most commonly used substance by youth. Alco Pops are the most common. These are sweet flavored drinks that are generally around 4 to 6% alcohol. These products are sweet in nature. A lot of times these sweet flavors hide the alcohol content. And there's a lot of these that are even paired with energy drinks that have high amounts of caffeine, excuse me. One of them I want to highlight is this Four Loco over here. These are Alco Pop drinks, and they have up to 12% alcohol, which can be equivalent to a 6-pack of beer in one drink. And these are also packed with lots of caffeine. We know that a lot of these drinks, they can increase the rate for overconsumption, even though we're not anti-alcohol in our education and promotion. We believe, for some people it's okay to and normal to have a healthy relationship with alcohol. We know that teens don't necessarily consume alcohol like adults, right? When they consume with different motivations, and they often don't have a lot of insight and understanding to alcohol, right? Because they don't have a lot of experience, and a lot of their experiences are being informed by their peers, but also through social media shows and marketing that's targeting a lot of our younger audiences, right? And then the next thing, how are we helping kids navigate the nicotine landscape, right? And the evolution from combustible cigarettes to the electronic delivery system, right? Which was originally started by our cigarette companies and framed as a safer alternative to cigarettes. We know that this message is deceiving, right? Because for a lifelong smoker, helping them get off of nicotine is one thing, or get off tobacco products, right, with the desire to quit is one thing. But now, these companies have targeted through social media, and specifically, we have a whole generation of nicotine users that are now dependent on nicotine, right, and using nicotine that had never smoked a cigarette. This right side of the image here is actually a drawer from a local high school's administrator's drawer. And these products are showing up on our campuses and in our homes all over, right? And so there's an increasing amount of young people using nicotine. So one thing I want to highlight here is just understanding that cigarette, the amount of nicotine in the products is what matters. So 1 pack of cigarettes, right, there's an equivalent to 20 milligrams of nicotine in 1 Juul pod. You can see there's 41.3 milligrams of nicotine, which would be equivalent to 41 cigarettes. And then a puff bar, 50 milligrams of nicotine. And as you can see, 50 cigarettes equivalent. And then a Surin pod, 90 milligrams of nicotine, 90 cigarettes. And so you can see that the pods equal potency. And so these electronic nicotine delivery systems give our youth an ability to consume nicotine at high volumes of nicotine, right? With less harshness because of the way that it's delivered through the vapor. So one of the latest studies that we refer to a lot of times is the National Tobacco Survey. And in 2022, more than 3 million middle school and high school students used tobacco. But we know that they're not using tobacco, right? Or cigarettes. We know that they're using these electronic nicotine delivery systems. I think these numbers are actually low. And out of the 3 million, what we know is 2.5 reported using this vaping device. But not just to mention that, there's all these other products that are being targeted to our youth. Here's a tobacco-free nicotine pouch. These pouches operate like a chewing tobacco where kids can dip this stuff, but they end up, instead of spitting the tobacco out, they're consuming it, they're swallowing it. The Elf bar, which is, if you can see here, this product on the marketing says contains tobacco-free nicotine. And we know nicotine is the addictive chemical in tobacco. A lot of products are tobacco derived, meaning they're pulling the nicotine out of the product and putting it into another product, but this is actually synthetic nicotine. And there's been a lot of legislation and a lot of things to try to police and stop these products from having flavorings and being marketed to kids and everything, but there's so many loopholes. And our legislation is by the letter of law, it's by product. And so these products have to be constantly be updated and researched and then legislated to try to reduce the access points for our kids. So we also know the prevalence of polysubstance use among youth is more common in adolescents. Polysubstance meaning the use of more than one substance. And among e-cigarette users in 9th to 12th grade, almost all, 93% of them reported using other substances, right? So there's a prevalence of the progression of use that's happening among youth. And some of this is, propagated once again by the technology and the headlines that are constantly bombarding, right, our airwaves, right? 20 health benefits of cannabis that everyone should know about. The study, teen use of marijuana drops in legal states where it's legal. New data reveals no link between increased cannabis use in teens and legal markets. Another one, vaping deaths, why e-cigarettes may not be as bad as the headlines say. So we all know as adults that there's everything on the internet is not necessarily true. A lot of the articles and the research projects and the things that are being propagated, are driven by motivation, right? For these products to be accessible and promoted. And a lot of times it's the money that's driving that. So how do we help our youth, right? How do we help our adults, our communities navigate this and sort through the information that is out there, right? And so one of the organizations that we find is a great one in speaking into the cannabis, understanding the cannabis culture that we live in and the world that we're living with, that is Learn About SAM, Smart Approaches to Marijuana. You should check them out. But one of their latest studies, actually counterbalances and really brings some really, what I would say is some clarity to a lot of these misinformation from the other articles that I showed you. What they found was the use before the age of 18 increases the likelihood of a marijuana use disorder by 7 times. And their studies also show that 1 out of 6 teenagers that are using under 18, using cannabis products under 18, end up progressing to the point of a cannabis use disorder. Another thing that they do is they follow these legal states, where the states where marijuana has been commercialized and recreationalized, and where legalization is associated, and legalization is in like Colorado. This studies from Colorado in 2020. There is a 25% increase in marijuana use disorder among 12 to 17-year-olds, right? So we know that kids are using cannabis more and more, and part of that is because of what's happening across our country. And so it's safe to agree that even by looking at this in 2024, there's 38 states that have some form of medical or legal or decriminalized marijuana policies. And so this complicates things for our youth, right? Because it's clear that we can't agree on these things. And even in Georgia, CBD with THC oil is legal, right? And so, but even with the legal cannabis, right, and the commercial, and recreational states, being close to each other and side by side, we know because of the internet, our young people can access these products very easily. And so one of the things that I think has added to the complication, but also increased the challenges that we experience is the Farm Bill, which was passed in 2018. And with the Farm Bill, basically what it did was it removed hemp, which is a cannabis plant, from the controlled substance list. And with that, it might have been a win for the hemp industry, but it was a loss for our families and our communities, because we know that marijuana has become significantly more potent than ever before, right? In the 60s, when marijuana kind of first hit the scene here in the States, we know it was around 2%, less than 2% of THC. And then, over the years, it's evolved, right? And even now in 2024, we know that the marijuana flower bud can go from anywhere from 18 to 36% THC on average. And then you have things like dabs and butter and THC oils and extracts and edibles. And these high THC content products can have 70 to 95% THC on average. And then obviously you have the CBD market, which is, CBD is a non-psychoactive ingredient that the medical community believes can be really helpful in trying to treat medical conditions, right? So it's the potency, right? And if you go back and you think back to the nicotine, right? It's the potency of the nicotine and the amount of nicotine that actually leads to, a nicotine use disorder, right? Or an addiction to nicotine, right? And the same thing is happening here with cannabis. And so these products, right? These THC products and these extracts and these synthetics and edibles, right? It's like the wild, wild west, right? And then you can also see that these products are now in candies, and a lot of these candies and these packages, I think in a lot of ways are targeting, our youth, right? And all of these products have high THC levels and there's varying ways, and degrees of ways to consume them that make it an easy access point for people to use. We also know that with the evolution of these products, there's also been an increased amount of cases for psychosis, where people are literally having a psychotic experience from these high THC products, right? So because of the Farm Bill, we also are seeing these products everywhere, Delta 8, Delta 10, and CBD products everywhere, flooding the market. Like I said, these products are like the wild, wild west. They've now found a loophole, and how do they get these products everywhere? These products are at gas stations, they're at health food stores. These products are at vape shops, and the cannabis industry, the providers are targeting our communities and flooding our communities with these products. I want to highlight one thing as we get ready to transition towards the end here. I live in downtown Atlanta, and I commute a lot, and on 85 North, I'm constantly riding past this billboard, and it's this company, Hello Mood. And Hello Mood is a company out of California, and this company basically they sell Delta 9 THC, which is the illegal form of the controlled substance that's illegal federally, but they also sell other products, Delta 8 and Delta 10, but also this other product that's called THCA, right? So going a little bit deeper here, you have to be 21 to open this site, but this billboard is in Atlanta every day when I come up to, up 85, it's on the right, and it's promoting, hey, it's called Mood. How do we help change our mood, right? And so Dante's Inferno, I want to highlight here. Dante's Inferno has THCA content of 27.7, percent THC. And the next thing I want to highlight is, if you look a little bit closer here in the middle, it says the product details. THCA, which becomes regular Delta 9 THC when heated or smoked, right? So here, THCA is not legislated, right? Not illegal according to federal legislation, but when it is heated or smoked, it turns into Delta 9. And here's that, once again, that 27.7 high THC potency and content. So this is the stuff that we're having to deal with. That's why prevention and early intervention efforts are so important, right? And not just providing information, skills, and support, but how are we working on a local level and a state level around understanding these policies? And there's a lot of work even happening right now downtown to kind of safeguard Delta 8 and Delta 10 in the proliferation of these products across our communities. We also know prescription drugs are another way that people are treating their mental health challenges. And in the early 2000s and mid 2000s, there was an opiate crisis that we were experiencing because of the overprescription of pain medicine that led to a lot of prescription drug monitoring and a lot of cutting off those access points, and to the point where it led to an opiate crisis and heroin crisis, right, that we were dealing with. And now, that heroin crisis has now led to a fentanyl crisis. And what we know is that the state government here and the county government and nationally, the DEA, we're confiscating a lot of counterfeit pills, right? Prescription drugs, medication, counterfeit prescription drug medication, and they are cut with fentanyl. We know that fentanyl is a killer. Fake pills are often laced with lethal amounts of fentanyl, and we're seeing overdose skyrocketing across our communities. And the reason why prevention and early intervention really matters, because if you think about it, like the experimental use and the experimental phase doesn't necessarily happen, because if a person gets fentanyl, it's not like they can find resilience or find a recovery community, because a lot of times they're dying, right? They're overdosing and they're dying, and they're not expecting to take fentanyl, but they're getting it through a lot of these counterfeit pills and other illicit drugs. Even, illicit drugs, there's stories of even marijuana and, other drugs like Molly, and ecstasy, even cannabis, right? Products are now being cut with this stuff. And so it's a really dangerous world there. So, and this is across the state of Georgia. We see there's an 800% increase from 2019 to 21 with fentanyl related adolescent deaths. In 2021, overdose deaths among adolescents increased 20%. Fentanyl overdose deaths increased at a faster rate than adults. And then ultimately 59% of overdose deaths involve counterfeit pills. And this is just the data to kind of back that up. And I know in 22 and 23, those trends are continuing to increase. So we do a lot of education about, and we do alcohol, tobacco, and other drug education, but all of the message behind Pathways to Life is helping people say, okay, on the surface, the people are using these substances, but it's what's underneath that we really want to target. It's that journey of growth and development. People finding out who they are, where do they fit in, and what's their purpose, and how are they navigating the challenges and obstacles that are a part of our journeys and our stories. And so, I love this. And as we get ready to transition to Q&A, Dr. Gabor Mate, what he said is addiction or dependence often originates in a human being's desperate attempt to solve a problem, the problem of emotional pain, of overwhelming stress, of the loss of connection, of loss of control, of a deep discomfort with self. And so what we know is we all have these growth opportunities and these challenges, right? The problem of pain, stress, loss of connection, loss of control, and struggling to find ourselves, right? We all have this. And so what we know is, and a lot of times in this journey of stress and pain, it's what's accessible to people. People can easily access substances, so they turn to these substances. Like for me, I discovered I didn't have a drug problem. I had a drug solution to all the other areas that I never got the skills or even had the words or the place to unpack and put words to what I was feeling and experiencing. And so it's so important. So I know the recovery work is so important that we're doing in the communities, but it's important that our recovery and our treatment and our prevention and our community, we come together, right? And this is we all represent what we call the continuum of care. And at Pathways to Life, we call it how do we create a growth-oriented system of care that helps people identify where they're at and then get connected to the appropriate level of care across the continuum. And even in our work, we see there's a huge intersection between prevention and harm reduction, right? And so in our work at Pathways, when we're meeting with a kid, we're coming in a lot of times, we don't know if they have a substance use disorder. We don't really understand, if they have a co-occurring disorder. We seek to come in and begin to explore with the young person and their family to get insight into what's going on. And so, sometimes kids are not interested in giving up their solution right away, but it's how do we partner with them to help them understand what's what's really driving the use, what's really driving the behavior, and how do we help people grow and embrace their own journey. And I want to close with this. So I love this quote: almost without exception, those who survive tough times give credit to one person who stood by them, supported them, and gave them a sense of hope. And so I just want to thank you for your time today and being a part of this. And maybe if you're not here and you watch this at another time, you can actually be a person that walks with somebody through their challenge and bring hope to them in a way that only you can. And we all have those opportunities a lot. And I want to encourage you to continue to push through, to find your way to resilience, but also to be open and available to provide that hope to others. So now I think we're going to transition to a time of question and answer to our audience. Thank you guys so much.
Thank you so much, Ryan, for such an amazing presentation. If it is okay with you, you can go ahead and stop sharing your screen. Perfect. So I also encourage our audience, if you all have any additional questions, feel free to use the Q&A panel. You have also received such great feedback from our audience on just, everything that people have been able to take away from the information that you provided. So I want to hop into our first question. Can you share examples of successful prevention strategies that were implemented by Pathways to Life that have empowered students and caregivers?
Yeah. So, I mean, we have a lot of different delivery methods that we use across the campus. I think one that we've seen the most success recently is what we call focus sessions. And our focus sessions are designed to identify audiences of kids that represent different grade levels, diverse population of students, and we pull them together. And so it's our approach to a focus session and a focus group and a listening session we've combined together. And what we do is we create a safe place to begin to help kids put words to some of the challenges that they see in their setting, right? In their grades, in their peer groups, and in their communities. And then from that, then through that facilitation, we're garnering that trust, right? Because we're starting out with listening first. And every time we have those listening sessions, we end up identifying several students that want to be champions for the cause, right? They want to help not only bring their voice to the things that they're experiencing and they're seeing, but also to bring their creative energy to help us partner with us to create solutions. And so that's one way that I've seen that work. Another way too, I just in sharing, I think it's having these conversations are so important, but it's not just what you say, but it's the words you use and how the tone of the conversation. When we enter a school, sometimes we'll host an unplugged event. A lot of times these are bigger assemblies like grade level, which can be a little bit challenging, right? The large environment presentations, but we've even had kids at the end of this presentation, come up and ask for help, right? So every time that we do an event or we provide information, we do a campaign, we do a focus session, a listening session, we deliver classroom education, we do peer leadership stuff. Every time we always give kids an opportunity for a linkage to care every time, because, you can't plan for crisis. I don't know if y'all know this, but Mike Tyson is getting ready to fight again, and which is awesome. He's like 57. I'm thinking like, man, what a hero that he at 57, he can fight. But people are always like, Mike, what are you going to do? What's your plan? And he's like, everybody's got a plan until you get hit in the face. Right. And so life has a way of throwing us punches at different times of our lives. And so I think the consistency of a prevention message and a collaborative prevention work, you never know when somebody's going through something, right? And a lot of times when people are going through it, we don't know, right? They got a smile on their face, they're showing up, they're crushing it. Sometimes we can tell maybe by what they're, what's happening in their life at the time, but a lot of times we can't, right? So I think those are some ways that we're seeing some impact and some effect through our initiatives.
Yeah, thank you so much for sharing. I appreciate how you brought in that linkage to care piece, because, prevention messaging is always great, but like you said, you can't plan for crisis. And so that continued linkage to care, it increases that accessibility to resources. So thank you so much for that perspective. So moving on to our next question. In what ways do prevention strategies intersect with recovery support services within Pathway to Life's framework?
Yeah, no, that's a great question. So, there's a lot of substance, use happening on our campuses, right? With the increasing access and availability and the amount of stress kids are dealing with, kids are turning to these products, right? They're developing relationships with these products. And so these products are showing up on the campus, right? And so, it's like, and what we found is that, punitive strategies don't necessarily work. I was incarcerated several times before I kind of got it together, right? And so what we try to do is we partner. One of the ways we're doing this is we're partnering with our schools to identify kids that are in a youth cycle and showing up on campus. And what we do is we partner them with our growth specialists and everybody on our team. And we feel like we're all kind of growth specialists, not just on our team, but just in general. I think we're all kind of recovering from something, you know what I mean? And we've all had to go through something or grow through challenges or whatever. But on our team, all of our people are people with lived experience, whether that's, some type of sexual trauma or brokenness or substance use or anxiety or depression. And so our brief intervention, our growth specialists are working with these young people to kind of help them explore their inner world, right? To begin to get a broader understanding to the context that they're living in, their environments. And, and in those settings, what we're seeing is a lot of connection that happens when you have persons with lived experience willing to be vulnerable and share their work. And so that's one way. Another way that we're partnering with the recovery continuum. So we have everybody on our staff. Obviously, I'm in recovery. The majority of us on our team, like I said, have a story. All of us have a story and we're all willing to use that. But another way we see this is in our community work and our coalition work, our community collaborative work. And, the importance of having peers, right? People with lived experience at the table, because they bring a new level of empathy and understanding, but also insight into what doesn't work, right? Because if it worked, then maybe we wouldn't have ended up in that situation. And so having people with that perspective and those experiences is so important for the cross continuum work. And one of the important things about this is like, even when we're working on a campus, I mean, a lot of times what we're doing is we're intervening with the staff, and we've even helped staff, that are dealing with mental health or substance use find their way into recovery through our work on the campus, right? So, and then how do we connect those folks to the broader recovery continuum, the broader recovery community that in our community supports a lot of different paths to recovery. So how do we help them find their way to getting connected themselves? And so, which is really cool. So we're not just doing student stuff, we're doing teacher development, right? And those conversations lead to even the adults, the teachers saying, hey, I need help. Like, I need help too, right? And then we're able to be a linkage to care. Obviously, Pathways, we don't deliver those services, but we do have a lot of partners with our broader recovery community and our treatment community to help people get connected.
Thank you so much. I appreciate this systemic perspective, right? Like being able to intervene and to assist students, but also that may result in, work with school personnel and teachers and parents, and really being able to be of service to the entire system. Because you can't like just go in and just help one group or audience. It's not as effective like that. So yeah, I appreciate that. And then last but not least, could you elaborate on the role of caregivers in Pathways prevention initiatives and how they contribute a sense of like belonging for students? So this could be teachers, it could be parents, but expand a little bit more on that.
Yeah. So all of our staff, the people on our staff are, like I said, people with lived experience and willing to share that. I think our person-centered, strengths-based, solution-oriented approach, I think is probably one of the most effective ways to work with people. believing that people, are really, they're an expert, right, of their own story in their life. Now, young people, a lot of times they don't have a lot of experience, or if they don't have a safe place to kind of unpack some of the stuff, they don't make the connections that are important to happen so that they can take ownership of their and responsibility for their resilience journey. So I think, those just approaching the strategies from that mindset and those approaches. MI, all of our people are trained in MI, motivational interviewing, which is, and I know that's when we think about our peer workforce and even our counselors helping professional people, how do we help people understand the role of partnership with people and how you be with people that creates a safe place? Because ultimately, I get this all the time. Kids are like, I'm working with them and they're like, or parents, they'll be like, what do you think? The kids primarily, but what do you think I need to do here, Mr. Ryan? And I'm like, well, my role is to help you get more clarity on where you're at, and, how to make the connections to your behaviors and your desires and your dreams and your future. But if I give you too much advice, then I'm taking on a role that's not mine. You know what I mean? And, so we can provide a safe place for people to unpack that. But I think it's how do we partner with them in helping empower them so that they take responsibility for their growth, right? And for their desire to change. And then also, how do we deal with the ambivalence that often exists, because everybody wants to change. You know what I mean? Like when you really get into it and you start to unpack, you find a real safe friend or a safe place and you start to unpack things, we start to make connections like maybe this is not the healthiest relationship, or maybe, my relationships to substances is not the great, or the amount of time I spend online, or whatever, the amount of chocolate I eat before bed, or ice cream, or whatever. But at the same time, there's often conflicting desires, right? There's ambivalence, right, that exists. And that's the tension that we all experience when we want to change something, right? And so how do we help people work on their internal motivation system, right? What motivates a person so that when somebody does take responsibility, they're connected to the core desires and the drives that are going to cause them to persevere with the challenges that are a part of change, right? Because change is awesome, but it's not easy, right? And so we're empowering with them on that internal motivation and reconnecting to who they are, their own journey of self and discovery. But then we're also supporting them, right? Helping them connect those relational frameworks and environments to support them. So that's what I would say. And thank you so much for the opportunity to share a little bit today. Grateful for the privilege to partner with you. Thank you for the work y'all are doing across the state with Georgia Recovers and partnering with the Georgia Council, all of those Shatterproof, all of the people involved, DBHDD, thank you.
Yeah, thank you so much, Ryan, for such an amazing presentation. And we'd love for everyone to complete our survey just to let us know how we're doing. And Ashley was able to drop that in the chat as well. Thank you so much, Erin, for serving as our interpreter for today. We appreciate you so much. But outside of that, that concludes our March webinar. So looking forward to seeing you all again soon. Have a good one.
Thank y'all.